very pleasant good evening to our viewing and listening audience, and welcome to another session of HealthWise, a program which has been formed through a collaboration between the St. Kitts and Nevis Medical and Dental Association and your nation's station, ZIZ Television. Our aim is to bring information and education to our people on selected health topics with the appropriate resource persons who are willing to volunteer their time and their knowledge to spread the information that would help to make us all health wiser. That's very important. Now tonight we will be discussing the topic deep vein thrombosis, otherwise referred to as clots in those deep veins. We will also be looking at pulmonary embolism, or clots on the lung, clots that find themselves in the lung. And to help me discuss these two very important topics, I have with me on the far right, Dr. Cameron Wilkinson, who is the Chief of Staff at the Joseph and France General Hospital.
Good night.
And Dr. Natalie Osborne, General Surgeon, also at the Joseph and France General Hospital. And together we will try and dissect this topic such that when we're finished, we're hopeful that you will be well educated and properly versed in the topic of clots. And you will be able to answer the question at the very beginning, what is that? Now, this topic I think is important for a number of reasons. What are these reasons? These are very common conditions. These are also potentially life-threatening conditions. When I say common, in the United States, you have over 200,000 people annually suffering from deep vein thrombosis. If we were to translate that on a per capita basis to St. Kitts, what that would mean that we could be looking at about 20 to 30 cases annually here in St. Kitts, and that would be a significant number. These conditions also are often misdiagnosed or underdiagnosed and as such left untreated. According to the Mayo Clinic, they can result in death of up to 1/3 of the people who go undiagnosed or untreated. The topic recently, as you would realize, got lots of airplay as a result of the COVID-19 patients and some of the complications that we were observing in them. That is to say, problems with clots in their lungs. Tonight, we don't intend to spend time on the COVID-19, but I use that as a reference so that we can see and understand the importance of appreciating what are these clots all about. We have to strike a balance in the human body between clotting mechanisms and bleeding mechanisms. You don't want to bleed to death, and at the same time you don't want the clots to form and cause similar end results. So the need for this topic is clear. We need clots, of course, to prevent bleeding. When you get a cut, everybody gets a cut at some stage. Everybody gets a little boot up, as we say, and get those cuts on your feet, on your hands. And in order not to bleed out, the proper mechanisms must kick in. That is to say, when you get injured. At the same time, we have the clotting mechanism that cannot be allowed to go uncontrolled, such that it ends with those major complications which we hear about, the clots on the lung and the clots in the deep veins. So as a result of this, I want to pose my first question. I want to bowl my first ball to the opening batsman, Dr. Wilkinson. What is the normal clotting process like? In other words, what prevents us from just bleeding out when we get a cut?
Well, first of all, before I answer the question, I just want to thank you for inviting myself and Dr. Osborne on the show to speak about a topic, as you said, that is very common and can go undiagnosed or undiagnosed And sometimes we might see somebody who was walking around normally, next thing now you're listening to a death announcement and you're shocked to see this person's name is being called. And some of these cases could have been secondary to clots that were misdiagnosed or underdiagnosed or missed, and the person might have ended up with a massive clot to the lung and died. And so I'm very happy that we can share the information with persons. So you ask what happens with the normal clotting process. So let's say, for example, one were to get a cut. If there were not certain triggers to prevent the blood from not pouring out, this person would bleed to death. And once the blood vessel is damaged and bleeding starts, there are certain things that go into place. The first thing that is formed is what is called the platelet plug. There are some small cells that are produced by the bone marrow and are normally circulating in the blood. And once the vessel is damaged, these cells rush to the area to form a plug to block the hole. The same way if you have a pot that is leaking and you choose to put a plug to prevent the water from leaking out, that is the same thing these platelet plugs attempt to do. And so they actually are formed into the shape of a plug to block the hole in the vessel to prevent the blood from leaking out. In addition to doing that, they release certain chemicals that mobilize other platelets to the area of injury, and also release certain chemicals to bring other cells there so that they directly plug the vessel. The vessel also goes into what's called vasoconstriction, which means that it tends to narrow down to prevent the blood from spouting out. And that is why some persons, for example, they might start bleeding, but by the time they get to the hospital, the bleeding may have stopped. Now, the next thing that happens is we have expansion of the clot, or the clot continues to grow. And this is triggered by a number of chemicals or factors that are called clotting factors. Most of these are produced in the liver, but these trigger a cascade of events that lead to fibrin being formed, which is a strong fiber-like substance to bring the clot together so that the clot becomes tough and durable. So this plug that is formed that blocks the hole in the vessel is a real tough plug. Now, once that plug is formed and the bleeding has stopped, there are other mechanisms that come into play to make sure that this clot does not continue to grow out of control, because if that clot continues to grow out of control, it can block the entire lumen of the vessel, or you can have extra clots that can break off and cause problems. And so there are another set of chemical reactions that go into play to stop the growth of the clot. And then once the healing has taken place, there are also other reactions from the body that go into place to break down this clot, because it will no longer be needed, and to remove the clot from the system. So the four things that happen then when one gets a cut is you have the platelet plug that is formed, the clot continues to grow until it blocks the entire hole. Then we have reactions that come into play to stop the further formation of the clot. And once the clot has done its job, you have mechanisms that go into place to remove the clot from the system. And so that is the simplest and easiest way to explain what happens. And so that is why even if one gets a paper cut, one doesn't bleed to death.
Yeah, that sounds like a very perfect mechanism of protection that the human body has to be able to prevent the bleeding out. And I must admit, those who expound on the religious issues would say that the work of God is perfect in this case. Now, Dr. Osborne, when we speak about deep vein thrombosis, abbreviated commonly on the street DVT, what exactly is this DVT? What exactly is this deep vein thrombosis that people are hearing about?
Okay, well, as Dr. Wilkinson opened by saying thank you for having us here this evening, to ZIZ and to Dr. O'Loughlin on this program. So what happens, as Dr. Wilkinson explained, what happens, the process and the physiopathology that happens behind formation of a clot. So when we have a deep vein thrombosis or clot, these can happen in the upper limbs or in the lower limbs or the legs. Most times these clots happen in the lower limbs or within the legs or the thighs, in the major veins that we have there, okay? And these clots, as we said, they're deep, We have the superficial veins and we have the deep veins. So most of the times these clots occur in the lower limbs within the deep veins that are deep inside the muscles and the inner tissues. And this can cause some serious problem. It can happen to anybody, and it can also cause disability. It can even, in many times, lead to death. But the good news is a lot of times we can, with early diagnosis and early treatment, we can prevent these, the complications that happens as a result of the clots.
I just want to interject here also because just to emphasize the point that Dr. Osborne made about the fact that these happen within the deep veins, because ever so often I might have somebody who comes to see me because they're concerned that they might have a clot, because persons have heard about the clot, but there's a lot of misunderstanding, and so they might have hit their leg and have a little bruising or a bump on the leg, and they think that is the clot that we're talking about, but that is just a superficial hematoma. Or you might have somebody who would have gone for a blood test. I'm sure you've seen this quite often, and they have some, ecchymosis or swelling at the site, and they're worried that this might be the clot that we're talking about. That's not what we're talking about. Or some persons might have been hospitalized and they had an IV, and a week or two after discharge they can feel this hard thread along where the IV was, and they're concerned that that is the clot that we're talking about. That is what's called superficial thrombophlebitis. But that is not the...
Yeah, but what I would like you to look at this point in time is the clots in the deep veins. These are the ones which seem to be of concern at this point in time. And why is it that they are so important as opposed to a clot on the surface, on the hand perhaps? Is there any major difference? Is there any major...
Yes, the reasons why we are concerned about the clots in the deep veins is that these clots might break off, and if they break off they can spread to the lung via the bloodstream, and that is when one will get what's called a pulmonary embolus. And if this is small, if it's just a small clot, the person might have minor symptoms and they may recover. But these clots can be quite large. As a matter of fact, one of the largest clots that one can have is what's called a saddle embolus, where you can have such a large clot that it blocks the main vein vessels going to the lung, and so you don't have any oxygenation and the person will die suddenly. And so that is why these clots are so important. And so one can have serious medical emergencies if these are not dealt with.
When you look at complications, any specific complications you can identify that can come as a result of these clots in the deep veins? Yes.
Well, in addition to spreading to the lungs, they can cause complications even as they stay in the leg there, because one can get what's called post-phlebitic or post-thrombotic syndrome, because there are two types of vessels in the lower extremity. You have the arteries that carry the blood into the limb, and you have the veins that drain the blood out. And if one has a clot that is blocking the vein, then the blood is not able to flow out of the leg, and so one may get persistent swelling of the leg that is called edema. There are some patients who notice this themselves. They will say, "Doc, when I press my limb, because it's swollen, they can see the thumbprint being left there." A sink, yes, okay. Some persons may get leg pain because they're standing up all the time. I can tell you that most of us get leg pain on a Thursday after we're standing up all day. I do get some leg pain, but we're talking about persistent leg pain when you have your leg hanging down. Another sign of this post-thrombotic syndrome is discoloration of the leg. There are some persons who get this dark discoloration around the ankle area, and the reason for this is because the blood is unable to flow out of the leg. The red blood cells eventually force themselves out of the blood vessel and become deposited in the tissue, tattooing the tissue, so that they have this dark discoloration or this purplish discoloration around the ankle. And this is what is called hemosiderosis. And some persons eventually, because of the increased pressure buildup within the tissues, they can get ulcers also forming. And these ulcers are usually around the ankle area, the medial aspect or the inner aspect. In the old days, Dr. Osborne wouldn't know about this, but we used to call them lifetime sofa.
Yeah. Well, all right. We have been moving along nicely, but it's already the first 15 minutes, so we have to take a short break for station identification. And when we come back, we're going to look at some of the risks for development of this clotting phenomenon. So after our break, please stay tuned, and we will be right back. And tonight, we are in the process of discussing a very important topic, blood clots. Many of you would have heard the phenomenon deep vein thrombosis and pulmonary embolism, specific clots in the human body, which have been causing lots of problems, and more so the pulmonary problems coming out of the COVID-19. So we will dig a little deeper. Now, Dr. Wilkinson and Dr. Osborne, who is at risk for the development of deep vein thrombosis?
Okay, well, before we get into the depths of the risk factors, I want to speak about a little physics as it relates to the blood flow, so that we can understand the reason why persons will develop these clots. Because way back in 1856, there's a German physician whose name was Rudolf Virchow. I'd love to hear that name, Virchow, where he came up with three things that are called the Virchow triad that he thought was responsible for persons developing blood clot. And he said, number one, if you have any alteration in the flow of blood that leads to stasis or slowing in the flow of blood, then if the flow slows down enough, you can have a clot being formed. And when we speak about the risk factors, you will see some of them are related to a blockage or slowing down of the flow of blood. He also noticed that if you have anything that damages the vessel wall, so it exposes the inner portion of the vessel wall, you can have clots being formed on that damaged vessel wall. Or if you have anything that alters the constituency of the blood so that the blood becomes sticky, or you have what's called hypercoagulability, then it can lead to increased clot formation. So eyes off those three factors, whether you have a decrease in the flow of blood, damage to the vascular endothelium, or any change within the blood constituent so that you have an increase in clotting factors or platelets, or the blood becomes very thick, that can lead to the formation of clots. And so that is the basis from which Dr. Osborne always speak about, I guess, the clinical risk factors.
I think you laid the groundwork really for further explanation, because that's very important. Yeah. And people, I think, can understand clearly from those three basic conditions which you underlined, how clots can form.
Using your cricket analogy, I rolled the pitch then.
You did roll the pitch very well, obviously for the West Indies.
Yes.
Okay, so if you take it into the three factors that Dr. Wilkinson just spoke about, where we can have damage to the inner lining of the vessel, where you can have a weak flow, you can have hypercoagulability, or the blood becomes so thick with the different factors in it. These, you can have any of these three factors or a combination of these factors, and anybody can have a clot. And what are some of the risk factors for developing these clots? And let's talk about them based on the three grouping that he gave. In terms of injury to the blood vessel, anybody who's had a major accident, it could be a motor vehicular accident leading to a fracture. They might have a fracture there of one of their large bones, like the bone in their thigh, which is called the femur. You could have any severe muscular injury, or even if you would have undergone a major abdominal surgery. So such as if you have any gynecological surgery, you would have taken out your womb, you would have had any general surgery operations where you might have had a major surgery for a cancer, a tumor, to remove a tumor. Any person who would have undergone one of these major operations, they increase their risk of having a clot based on the damage to the blood vessels.
Dr. Osborne, because I remember when I was a young man, I had a fracture and had to be casted, and I thought that it was a very simple, innocuous thing, just a matter of waiting for the cast to come off. So you're saying that from a fracture I could have developed a clot that could have led to a pulmonary embolism.
Yes.
And then, and so it's important for persons to understand this, that although the initial injury might appear minor, the complications that can occur from that, or even you mentioned surgery too, so somebody might have surgery, it might have been successful, but they can develop a clot.
And hence when we speak about our preventive measures, we'll talk about how we encourage our patients to get up immediately or soon post-operatively.
Yes.
And quite often, of course, these complications would be unexpected.
Yes.
And people would tend to blame the surgery, but this is, in some cases, a complication of the surgery which was totally unexpected.
And sometimes it is within the person's own control in terms of mobilization, etc., which we'll speak about later on.
Yes. And so in terms of the flow of the blood within the blood vessels, a patient who's confined to the bed, hence we spoke about getting our patients mobilized as soon as possible. So if you're confined to a bed, for whatever reason, you may have had a major injury, you may be paralyzed, those persons are at increased risk for having a deep vein thrombosis.
So when you say confined, you mean somebody who's just lying down or just being lazy, and so that's one of the reasons?
Not just being lazy. If for whatever reason you may have, it's not that you're just being lazy, but if you have a fracture and you're immobilized, if you have, what do we say when we have?
A medical condition.
Yes, a medical condition.
But the point I wanted to make, though, that's why sometimes after surgery, even though somebody might be in pain, we encourage them to get up and move around, because just by lying in bed, you can have stasis, and that can lead to blood clot formation.
We also spoke, we can also mention persons who travel for long distances. You have a flight of more than 14 hours, and you're seated for most of that flight. That person has at risk.
Famous by the Vice President Dan Quayle of the United States. So when he was the Vice President and was flying around, and he claimed, that his problems, he had some problems with clots in his feet. And from then, more people became familiar with the possibility of long flights and not moving around and potential for developing clots.
Yes. And hence, once you're on a long flight, you're encouraged to move about every couple of hours. You are encouraged to get stand up, take bathroom breaks. That movement will help to circulate the blood and decrease the chance of formation of a clot. There are other risk factors as well, especially for young women and women who use birth control
Before
pills.
you move on to that point, you need to speak to the people who are afraid to move around on a plane. You know, you are recommending here, and it's very good advice. You're on a plane, when the pilot announces that you can move around, you move around. But people like me, I do not like to move around.
But
what the recommendation?
Your legs,
exactly,
Yes.
exactly,
So,
exactly.
You,
That
you
is
don't have
key.
to be walking around. You can be moving
Move your feet in place.
Because
in
even
place.
right now on this table here, I'm moving my legs, contracting my calves, etc. And another point I want to make also, because there's something that I couldn't do when I was a child, and I can't even do now, but I'm happy that I can't do it. There's some persons who can sit and fold their legs, cross their legs,
Japanese
etc.
style.
Yes, and even that, if you sit in that position for a very long time, that can predispose you to developing a clot also. So you shouldn't keep your legs crossed for a prolonged period of time. That could obstruct the blood flow.
So things that can cause an increase in estrogen, for example, when a woman is pregnant as well too, she could be at increased risk for developing a DVT. The mere fact, because the estrogen, what does it do? Increase the coagulation factors and increase, it makes the blood a little bit thicker, as we say. Hypercoagular as well too. Also, if you take hormone replacement, if you're a woman who's in menopause, some women, because of the changes that happen during menopause, the woman may have to use hormone replacement that are high in estrogen. These women are at increased risk for developing a clot. And if you're taking the birth control pills as well too. So those are risk factors that...
And I'm glad that you mentioned the hormone replacement therapy, because I know many years ago, there are a lot of women who just went through menopause as a normal change in life. But then there was the advent of the hormone replacement therapy to control these menopausal symptoms. And we are realizing more and more that these hormone replacement, they have side effects. One of them you mentioned is about the clot, but we also know that it's associated with breast cancer also. And so I'm saying to persons who are going through menopause, if you can withstand the hot flashes, etc., you understand?
The heat of the flashes.
Why are you laughing? What did you do when you were going through?
Thankfully, I'm not there yet, but it is very easy for you from a man's point of view to say that, but with all the symptoms associated with it, there's a reason why women do take these drugs. But it's always important to know that they do come with risk. There are many risks associated with them. So there are certain other chronic illnesses as well that can lead one to have a deep vein thrombosis or to have a clot in the vein. You can also have lung disease. There's certain lung disease that can increase your chance of developing a clot. If you have heart disease as well too. If you have cancer, and sometimes even the treatment from the cancer, the chemotherapy, they put you at risk for developing these blood clots. So when you look at most of the risk factors that we would have mentioned, having the cancers, having the heart disease, having the lung disease, having using of the hormone replacement drugs, if you're seated for a long period of time, sometimes persons who work at a desk in their office, they're seated for many hours and then they don't move around in their office, and those are persons who are at increased risk.
As a matter of fact, there are some other factors too, because you might have had a clot, develop a DVT, or develop a pulmonary embolus, and you thank God that you got over it, but that puts you at increased risk also. So anyone who had a previous DVT or pulmonary embolus, they're at increased risk for developing a clot. If one has a family history, and so if you have a mother or father or some close relative who had a clot, you might be at increased risk for developing a clot.
Strangely enough, I encountered an individual who once had a DVT and thought that that was it. They didn't realize that they was at increased risk for getting another one.
Yes.
Perhaps not even changing their lifestyle, options and so on. They would have still been at higher risk. But we need to take a short break at this time. It's now 9 o'clock, top of the hour. And we're gonna allow the station to identify itself and the sponsors. When we get back, we're going to open the lines. We're going to open the lines and we're going to welcome any questions, any suggestions, any recommendations, and even any suggestions for future topics. The numbers to call, 466-2666. You can call 662-8674. You can call 767-4765. So you have a plethora of numbers to call. You have a choice whether you're going to go Digicel, Flow, and you call us. And we will be here waiting for your suggestions. So we will be right back after this break.
Wash your hands, wash your hands, wash your hands. Wash your hands, wash your hands, wash your hands. To keep away the flu, there is one thing we must do. Wash our hands, wash our hands, wash our hands.
Welcome back to HealthWise, program organized by the St. Kitts and Nevis Medical and Dental Association. And tonight, we are talking about blood clots. What is that? We've been digging deep so far. We've been defining. We've been explaining. Now we're at the point where we're looking at some of the risk factors for deep vein thrombosis. Dr. Wilkinson, what else can we add here?
Well, one of the risk factors, I'm going to tease you, but you may have this one, age over 60. You know? Because as we get older, the risk increase. And so once you get over the age of 60, staying active, etc., exercising, that might help to decrease your risk. Obesity, persons who are overweight. And so that's why one has to look at their weight. I know there are studies that come out speaking about the Caribbean having a very high obesity rate, and so it's important for us to control our body mass index. Smoking, as a matter of fact, I always tell my medical students, if you ask any question And even if you don't know the answer, if you say smoking, chances are you'll be correct. And I'm speaking about smoking cigarettes, okay? Because sometimes when I say smoking on television, when I come off, a lot of the persons who believe in the marijuana, they get offended.
Other things.
Yes, smoke other things, yes. So I'm speaking about smoking of cigarette, tobacco. That would increase your risk. There are some persons too who might have a catheter that would have been in place for IV fluids or even dialysis, etc. Those catheters, if they're there for a long time, they can lead to clot formation. And there are some persons who just have an inherited predisposition to developing these clots. So they may have some abnormality with their clotting factors, etc. And these persons are at great risk for developing clots. So those are the main risk factors associated with the development of DVT and pulmonary embolism.
In the very beginning, we did mention that there's some people who go undiagnosed or misdiagnosed. So I want to ask Dr. Osborne, what sort of symptoms can you look for if you're trying to diagnose a DVT? What symptoms are associated with that particular condition?
But as you said correctly, not everyone who has a DVT may have symptoms, okay? Or sometimes a patient may have mild symptoms and may go unnoticed. But some of the symptoms that are associated with developing a DVT is most of the times, as we said earlier, that most of these DVTs are deep vein thrombosis or clots within the blood vessels. They occur mostly in the lower limbs, especially in the legs. So these patients can present to us with swelling. So the leg would be swollen. You may see one of the leg is bigger than the other. The person would tell you, Doc, I did not have any trauma. I did not hit my foot. Nothing happened. I'm sure I wasn't bitten by an insect, and my leg is swollen. They may also tell you that they're having pain within that same leg. Extreme pain when they get up, when they move around, they would realize that this pain. And at first they may think nothing of it. Oh, maybe I just pulled a muscle. But as the days go by, this pain persists. All right, so these are things that will draw your attention that something is wrong there. And you may also see that there's a change in color in the skin. You may have some red discoloration too. All right, and you may also, once you touch the leg, you may see that it's warmer than the rest of your body. So those are some of the things that you're looking for. You may also see that your veins that were not visible, they're more visible now. As we say, you have veins on your skin. You see all the veins, they're standing out on your skin there. All right, and you may feel extra tired in your lower limbs. You may feel some tiredness when you try to move around. You have aches and pains in those limbs.
Okay, well, so tied in with the DVT is the risk of developing pulmonary embolism. And so if someone, one of the reasons why we speak so much about deep venous thrombosis, because the deep venous thrombosis itself may not kill you, yes, but if you have embolization, and so if one has a clot and the clot breaks off and goes to the lung, then they can have a pulmonary embolus. And some of the signs, or one of the early signs, the person might start having acute shortness of breath. I know of a patient, for example, who had traveled on a plane, and 2 weeks later, she noticed that when she was just walking up her driveway or climbing stairs, she started to get short of breath. And it was so far from the history of travel that she did not really link it directly with the travel and had no symptoms at all related to the leg. And so one may develop a clot that starts in the leg and moves to the lung without even noticing the symptoms in the legs themselves. And so it is the shortness of breath and the tiredness that will bring them to realize that they have a problem in their lungs. Some person might just have a sense of anxiety. And so you might just have this nervous, frightened feeling within you, and you may not relate that to a pulmonary embolus, but that could be a sign of pulmonary embolus. If it is large, the person might have a bluish discoloration of the skin, or they may get cold and clammy. Some persons may have chest pain that can radiate up the neck or down the arm. And because this pain can radiate, sometimes persons associate it with something else, because you might have a pain in your neck or your chest and you think it's because you had hit your arm against something, not really realizing that this is related to...
You think you slept in a bad position.
Yes. Okay, some persons may have a cough, or when they take a deep breath they get pain. and what might bring person to the hospital when persons see blood. So some persons may actually cough up blood, and so if you're coughing or spitting up blood, that might be a sign that you have a pulmonary embolus. Some persons, if it is large enough and the blood flow to the lung is being obstructed, then these persons may faint, and so fainting can be a sign that the person has a deep venous thrombosis. Some persons will tell you, "Doc, all of a sudden my heart is like skipping a beat." They have this irregular heartbeat, and that could be a sign of DVT. Of a pulmonary embolus, or that they notice that even though they're just resting, their heart is racing. And so a racing heart or rapid heart, that also could be a sign of DVT. Some persons may just have lightheadedness. They realize that when they get up, they feel dizzy, and they might just think that this is just a sign of vertigo, when it could be a sign of a pulmonary embolus. And that's one of the reasons why we say there are persons who can go undiagnosed, because the symptoms can be so diverse, and some of them can be so non-specific, and persons associated with some other disease condition. Next thing you know, the person dropped down, and everybody, you do the autopsy and you realize that there was a large clot that caused the problem.
All right, so let me remind the general public that, if you have any calls, if you have any questions, concerns, recommendations, and suggestions, you can call our numbers at 466-2666. You can call 662-8674. You can also call 767-4765, and we'd be more than willing to answer your questions, take on board your recommendations and suggestions, including suggestions for future topics, because we are here to try and educate our populace on various issues. And I always underline the fact that Dr. Google cannot often see into St. Kitts to understand the specifics of the problems that exist here. So we try to answer those questions which you would put to us in relation to whatever medical concerns and conditions that you would like us to address. Now, this condition, deep vein thrombosis, pulmonary embolus, you mentioned certain risk factors, you mentioned certain symptoms, but we know in medicine, to be able to confirm a diagnosis, you have to do certain things. You have to perhaps make some examinations, make some tests. What can we do to confirm the presence of a clot?
It's good that you asked that, but you made a point that I always remember from med school, that you spoke about getting tests, different tests. And a good professor of mine said that most diagnoses can be made over 90% of the time with a good clinical history and physical examination. So if we're going to make a diagnosis of a deep vein thrombosis, it would be very prudent for the physician or the nurse or the healthcare profession to have examined the patient and sat down with the patient and taken a good history, taking into mind and taking into consideration all of the risk factors that we would have mentioned beforehand, and examine the patient's limbs, examine the patient well, looking for the swelling, looking for the testing for tenderness.
Okay, let's take a short break and accept a call at
There's
this time.
There's a question? Okay.
Is there a call on the line?
Good evening to the panel of doctors.
Good evening.
Good evening.
I would like to know, what are some of the non-pharmacological types of treatment for DVT, and what are some of the pharmacological types of treatment for DVT?
Well, we do appreciate that question, and we definitely will be addressing that. We're just trying to lay the groundwork, show how we can diagnose first. So we must diagnose before we treat, but we definitely will address your questions. We thank you very much for that call.
Thank you for calling. We'll answer that question later. Yes.
Okay, so we'll get to that question shortly. So I was speaking about taking a good history, examining the patients, and then we get some associating tests that we can use to assist us in concluding and making a final diagnosis. So we can do some blood tests. And I'm sure many of our listeners would have heard about blood tests like a D-dimer, where you take a blood sample and you're testing for certain factors or proteins within the blood. And these proteins, as we say, once we have a blood clot, there are certain things that are there to break down the blood clot, certain fibrin you're using, and this tests for that. So when you have a blood clot, you may see an elevation in what we call the D-dimer blood test.
Can we do that in St. Kitts?
We do that here on the island, but it's very, I must add though, although it can indicate that there may be a presence of a clot, there are also many other conditions that may have an associated elevated D-dimer.
So I guess in a case like this, what you do, you juxtapose the symptoms and the history,
yes,
and the result
yes,
result of the test,
yes,
and you come to some useful
yes,
conclusion.
Yes, because for example, if someone were to get hit with a hammer on their calf and they were to get a hematoma there, their D-dimer will be elevated once you check it, and so that's why the history is important. But if they came in with the calf swollen with no history of trauma and the D-dimer is elevated, we'll be thinking it's more of a blood clot.
Yes.
So that's why she said the history is important, knowing what happened prior to the person coming in.
And taking in mind that we always do a combination of studies to come to a conclusion of a diagnosis. There's almost never one particular test that can conclude it for us, so it's a combination. So you would do your D-dimer after you examine the patient. You can get a Doppler ultrasound. Many of us are familiar with an ultrasound where we use a probe and we can put it on the leg, and the ultrasonographer or the radiologist, they're looking at that point, looking at the blood vessels, looking at the veins to see if there is a clot that is inside there. And we do that as well here on the island. Okay, and there are other blood, studies that we can use. There's a specific one where you can inject a dye inside of the veins and take like some films or some x-rays. That is called looking for a blockage. That is called a venograph. And there are other things like the more advanced testing, like the MRI, okay, which is a little bit more expensive. But if we're still unsure after using these simpler studies, then we may need to do an MRI later on.
But let me say something about this MRI, because sometimes I have patients, they come in and they want to ask for an MRI right away. And I always tell them, it's like, for example, you having a fly here, and you can either kill it with a SWAT, or you can call in the U.S. Army to bomb it out of existence. Both will kill it, but which one is more economical? And so we don't always go to the MRI right away. We start with the basic history, physical exam, and the other investigations. And it brings us another important point too, because sometimes patients think that once they come to the hospital, you can make a diagnosis right away. But I always say it's like what you call again, detective, you know, sometimes you have to do a number of investigations, etc. So you might have a differential list where you have a number of things that you're considering, and as you do more and more tests, you hone in until you narrow it down until you eventually get to your diagnosis. And so those things that she mentioned are the investigations that you would do for deep venous thrombosis if you suspect it. And for a pulmonary embolus, there are some other tests that you would, because since the pulmonary embolus is in the lung, you might want to start off with a chest x-ray, because you might see signs on the chest x-ray indicating that part of the lung is affected. One may need to do an EKG because the electrocardiogram can have certain changes when someone has a pulmonary embolus, or you might see the abnormal rhythms that we spoke about. The MRI, one may also do that, or a CT scan, and that can give us information. There's another test that's called a VQ scan, or ventilation perfusion scan. And just in short, the lung, when you take a deep breath in and air goes in, that is ventilation. And the blood flow that goes to that area of the lung is called perfusion. And so there's a match between ventilation and perfusion. But if there's a blood clot, then there is no blood perfusing through that area. And so you would have a mismatch of ventilation and perfusion. And so by doing that type of scan, one can also make a diagnosis of a pulmonary embolus. One can also do a special test that is called that's called a pulmonary angiogram, where you're looking at the blood flow through the pulmonary vessels. That investigation is not available here, but it is usually only done if you are thinking about removing the clot at the same time. And so the fact that we don't have it here is not something that we miss on a regular basis, because most persons who have a pulmonary embolus would not need a pulmonary angiogram to make the diagnosis or even to institute treatment. And the ultrasound that she mentioned, you might also want to do this because someone may have a pulmonary embolus. It might be small, but you want to make sure that they don't have a larger clot in the leg that can break off and give further problems. And so you will still do the investigations in the limb, the Doppler ultrasound. You might go on to do the venography if you need it. And the D-dimer test, we'll also do those. We have another call.
Yeah, well, good evening, caller. Can you ask a question?
Good evening, doctors. Say someone gets up, or ever so often, you get up and you find yourself with some black spots on your skin, like as if you got a hit. So you find yourself with like lumps, black. You know, you can feel it is kind of hard.
Where on your skin? Where?
Hello?
Where on your skin? On your hand?
Like my feet on your hand, on your legs.
Yes.
And then, okay, I know about it. And then someone said because you suffer from like blood platelet problem. So because we're talking about blood clots, I begin to wonder if that should be a concern.
Yes, well, that's a very good question because there are a number of persons who come, and I think I mentioned it earlier, where they might see this bluish discoloration and they think that is the blood clot that we're talking about. But the clots that we're referring to are deep within the calf muscles or the thigh muscles, and so you don't usually see the discoloration on the skin. That would occur if somebody had trauma or somebody had some bleeding abnormality where they have a problem with their platelets, etc. And they would get that discoloration. And so if one is having that condition, they should go and see their doctor so that they can have
some tests done
to check their platelets or clotting factors.
Yeah, thanks so much for that question. You know, it obviously is an important question, and at least gives us the opportunity to differentiate clearly between what we're talking about tonight, the clots, and people who have other problems with their platelets, for example, where they can have problems and see certain signs and symptoms of the skin. Now, we so far have been looking at the various examinations and so on, tests that are utilized for the diagnosis of deep vein thrombosis. Now, it's so important to prevent a problem rather than have to treat it. So important, because if we prevent it, we can have more time to watch television or watch cricket, watch West Indies beat England, and not have to spend all the time trying to get this diagnosis going. So what can we do to prevent? What recommendations, what suggestions can we offer in relation to the prevention of deep vein thrombosis?
Well, we touched a bit on those earlier as we were talking about the risk factors. And when you take into consideration most of the risk factors, we can then make a comparison or draw from those what we can do to prevent. And we always speak that prevention is better than cure, because if we prevent developing a deep vein thrombosis, we're not left with the complication, which can often be long lasting.
So you're answering the caller's question,
yes,
who asked about the non-pharmaceutical.
Yes. So as we spoke about our risk factors, keep those in mind. So you want to encourage your patients, your clients, to move around as much as possible. We spoke about if you're on a long flight, if you're working at a desk for long hours, you're encouraged to move around, stretch your legs, and keep the blood circulation flowing. We encourage our patients oftentimes as well to, after major surgery, we encourage our patients as soon as possible to move around, because that stimulates the blood flow, prevent the development or the stasis that may happen within the deep veins, and prevent these individuals from developing a clot and the complication like a pulmonary embolism as well too. So you want to do certain things. You may have the patient, you may encourage the individual to stand on their toes and exercise their calf muscles, going on their tippy toes up and down several times, or going back on their heels. Because what that does at that particular time, you're contracting the calf muscles and increasing the blood return or the blood movement back up to the heart. And that is important because, as Doctor said earlier, one of the reasons we develop these clots is because the blood is pooling or settling or is in a state of stasis. So it is very important to do some of these things.
And it's actually important for persons to understand that we have a heart that will pump the blood down to the lower extremity, but the way the blood gets back is by the calf muscles contracting and pushing the blood
Yes,
back.
it is
And
very
so
important
you
to
need
do
to
that.
make sure that you keep moving your feet. I don't know whether you were in the cadets,
Very much, very present. Very
yes,
present.
where you were taught when you were, on drills and so on, at attention, you still need to be moving your
Exactly.
toes in your boots, etc., and that helps to pump the blood back. So
Well, not
even if
only
one
in the
cannot,
cadets, but I was in the Pathfinders, the Seventh Adventists, which is quite known for having that level of discipline as well, and the
Yes.
military style. But you also want to take into consideration, you encourage the individuals not to wear tight clothes as well, because the tight jeans, especially if you're going on a long flight, you want to make sure that you wear loose, comfortable clothing, like sweatpants, soft,
Yes.
light clothing that are easy.
I
that
hope
can
you
move
remember
around.
that.
Yes.
Yes.
And we spoke also about your weight. Those are things that you can control and you can modify. So it is very important that you encourage the individual to lose some of the extra weight. And if you're a smoker, you want to stop smoking as well too.
Well, what about the stockings? Yeah, there are some persons who can wear compression stockings also.
Yes.
As a matter of fact, and these don't have to be ordered by a doctor. We have a call.
Yes, well, good evening, caller.
Good evening.
Yes, good evening to the doctors. You spoke about not wearing tight clothes just now if you're traveling, but what about wearing compression stockings, because those are very tight?
Well, those are what we were just about to speak about. We were
Yes.
just about to speak about the compression stockings.
Okay,
Yes.
thank you very much.
You
Okay,
read
and,
our minds. You
yes.
read our minds.
And she actually is making a very good point, because sometimes persons wonder why we would say not wear tight clothes, but wear compression stockings, which are tight also. The tight clothes that we're talking about, sometimes they can be tight around the waist and
Yes.
the hips, and so it prevents the blood flow from going back up. Whereas the compression stockings, they are usually graduated. In other words, not just one tight elastic band, but it had a graduated pressure as you pull it up, so that it keeps the calf muscles
Yes.
contracted and helps to push the blood back to the heart. And so that's why it's important for you to wear these compression stockings when you are going on
Yeah,
a
and
flight.
what's important, I happen to know that lots of the pharmacies do have in St. Kitts available the compression stockings now, because we do lots of flying. Our people, we fly all over the world. We have connections far and wide,
Yeah.
so those
Well, as a
stockings
matter
are
of
so
fact,
important.
I will tell you a little secret. There is a friend of mine who, a couple of Christmases ago, and I'm sure he might be listening, he brought back a pair of compression stockings for me that are knee-high, and I wear them on an operating day, and I can operate, for hours.
And
That's the first
nobody
I'm
knows you
hearing
have them
about
on.
this.
Nobody knows, so you can be wearing these compression stockings and no one.
So
no
you
one
say you
knows.
can be discreet about
Yes,
wearing your
you
compression
know, because
stockings.
they're not the most beautiful, but you can wear them on. Yes.
All right, so we're looking at some of the other preventative measures that we can use. We spoke about the stockings. We spoke about the not using the tight clothing. We did look at the exercise for the feet, and of course, you address the people who are flying. Critically important, because there are lots of conditions and problems associated with flights, post-flight, obviously. So it's important that people who are traveling understand clearly that it's not just to go on the plane and sleep for the 8 hours and not moving around. Otherwise, you're putting yourself in one of those risk categories for developing clots.
And I want to take the opportunity here to speak about, to motivate our people as well to exercise, because obesity is one of the major risk factors as well too. And you spoke earlier, Dr. Wilkinson, stating that we have a high obesity rate in the region. So it is very important that we exercise. We have some sort of daily physical activity that would increase the blood flow, get the heart pumping, get the muscles, the calf muscles, returning all of that blood from the lower limbs back to the heart and preventing these blood clots.
Okay, what we're going to do now, we're going to take a short break for our final station identification, and when we come back, we're going to address the first question that was posed by our caller, and look at some of the pharmacological treatment modalities that are available, and available right here in St. Kitts. So after this short break, stay tuned and we will be right back.
The coronavirus is bad. So there is one thing we can do. Wash your hands, wash your hands, wash your hands.
Wash your hands, wash your hands, wash your hands. Wash your hands, wash your hands, wash your hands. To keep away the flu, there is one thing we must do. Wash our hands, wash our hands, wash our hands.
Welcome back to HealthWise, program organized by the St. Kitts and Nevis Medical and Dental Association. And tonight, we are looking at clots, blood clots. Lots of you would have heard about the problem seemingly being of significance in this coronavirus pandemic. We heard of many individuals who had lung problems, who ended up at hospitals with a variety of respiratory problems, and it was discovered that in a number of cases, blood clots were the basis of their difficulties in relation to their respiratory system. So that is why we decided tonight we will take on the topic blood clots and ask ourselves, what is that? So far we've looked at the diagnosis, we've looked at the risk factors, we've looked at what to do to prevent those blood clots non-pharmacologically, and now we're going to look at some of the other treatment modalities. So with no further ado, I'd say, my friends, what can we do? What can we recommend? What is there for the treatment of deep vein thrombosis and the other topic which we are discussing tonight?
Okay, but after we've done our best and we've diagnosed the DVT, we can do certain things for this individual or this patient. So The treatment would generally be geared to preventing the clot from becoming any larger or preventing the individual or the patient from developing more clots. So we use what we call blood thinners or anticoagulants. Many persons in our communities would be familiar with some of these drugs and take some of these drugs. So as we said that these drugs, they can be in the form of injection or they can be as a pill for most individuals. And there are many names as well too.
Just before you get on to the specific names, because you made a very important point that I just want to make sure that we bring it up clearly, because these blood thinners, as they're called, they are to prevent the clot from getting bigger. And the reason why I say this is why it's so important for us to make the diagnosis early, so that if somebody comes in and they have a small clot, you can put them on the treatment so it prevents the clot from getting bigger, because the bigger the clot, the greater the chance of embolization, pulmonary embolism, etc. And so these thinners do not dissolve the clot, but they prevent it from getting worse.
And also prevent you from developing other clots as well too, because you said earlier, once you've been exposed or developed one clot, you're at risk for developing clots thereafter. So you know that there are many blood thinners, and I guess both doctors would assist me with some of the names too, because many persons in the community are taking things like warfarin, Pradaxa.
Yeah, but the warfarin is, I think, is one of the oldest.
Yes, one of the oldest ones.
You know, and what I think people fear, you know, I've had interaction with a number of patients who were hospitalized for various clotting issues, and they say the doctors are coming around and give them a shot in the belly, and you know, they were not understanding why, what is the shot in the belly all about? That's, you know, which I suspect was heparin they were getting, you know. So, but I guess it is important for them to understand that if you're trying to prevent further clot formation, that some of these medications are important.
Yes, and most persons, once they're diagnosed acutely and they're admitted, they will be started on the heparin, and then they will be switched to a longer term, like the warfarin, etc. Now, in using the warfarin, you would have to be checking the thickness of the blood, to put it in layman's term, or what's called the PTPTT or the INR, to make sure that the blood is not too thin, because if they're taking too much and they go to brush the teeth and get a cut, they can bleed significantly. And so one always has to strike a balance as to how much medication you're giving them, so that they don't bleed to death if their blood is too thin. Now, the warfarin is cheap, but it requires the repeated sticking, etc. There's some of the more modern drugs like the Eliquis, etc. It is expensive, and it doesn't require this regular testing of the blood, and so you have to strike a balance between cost and the inconvenience of getting a stick. You understand?
And I just wanted to touch on something, because many times, and I think it's the onus is on us to explain to our patients, because oftentimes our patients in the hospital, and every day or every other day we're doing blood tests, the patient is being tested and they keep wondering, why am I being tested continuously? But as you spoke earlier, we have to strike a balance, and these testing are done so that you know the exact dosage, how much you need, so you don't go too little or you don't go too much, giving the person, making the blood very thin, leading to bleeding in these individuals. So that's why we ask our patients as well to be with us and to be patient and to be understanding. But I know sometimes it is difficult.
And it's important for persons to understand too that once you have developed a clot, you might have to have this treatment for 3 to 6 months, and some persons, especially if you're at increased risk, you might be on it indefinitely.
Yes.
And so it requires significant lifetime change.
You know, one of the factors, our people here have access to the internet and, you know, various sources of information. But there are 1 or 2 people who have asked me, if you're going to have a clot, why not try to bust up that clot? Because there are some medications out there called clot busters. I'm not sure if we have them available in St. Kitts. As far as I know, they're pretty expensive. But the general way that the treatment is utilized is through the blood thinners. So far, we use our heparins and our warfarins and so on.
Yes, so with the clot busters, in addition to preventing the clot from getting bigger, one can also use what's called thrombolytics to try and break the clot up. But these are usually used for more severe disease. Let's say, for example, if somebody has a large clot that is blocking one of the main blood vessels in the limb, and if the blood cannot drain from that limb, you might need to use the clot busters to try and create a passage. Or if one has a large pulmonary embolus. Now, the way these are given, if you inject it directly into the bloodstream, you can have a lot of side effects because it can cause bleeding elsewhere. And so these are usually administered by an invasive radiologist where a catheter or a small tube is put in. So if the clot was in one of the pulmonary vessels, they will direct the catheter all the way up to where the clot is, and then inject the thrombolytics to help to break the clot up. Okay, but that is not used too often, and it's used when persons have very large clots.
And we also must add that we do not offer that service here either on the island for most of our patients.
And of course, you can also have a group of people who, for whatever reason, can't tolerate medications whatsoever. You know, you always have that small group of people.
Yes, and so there are some persons who may not be able to tolerate anticoagulants, but they're at risk for developing DVT, or they have clots in their leg. And what is more serious about a clot in the leg is the clot going to the lung. And so what we can do is put in what's called a vena cava filter, which is like a mesh like that is put in one of the large vessels in the abdomen that's called the inferior vena cava. And that filter will capture any clots that are making their way to the lung. And so the person is still at risk for developing DVT, but they will not be at risk for developing pulmonary embolism, which is what can kill them.
Yeah, I think that's an important point to note, because people need to understand the DVT really doesn't do the killing. It's the complications from this DVT when it decides to break off and go swimming somewhere else. I think that's the message that we're trying to get across.
Yeah, but although the DVT doesn't kill the persons who develop the post-thrombotic syndrome as a result of damage to the veins in the leg, that can be debilitating in itself, you know, because there are a lot of persons who have ulcers on their legs, and an apt term, as I said, is the lifetime suffered, because unless you can replace those veins, which you can't, the condition is chronic. And so these are persons who, even if you were to bring them into hospital, sometimes we bring them to hospital, we put their legs up, you know, so the blood drains back to the heart. You can do a skin graft, but if they continue to hang their legs down, if they don't do the proper exercise, if they don't lose the weight, the ulcer will come back. And so these are sometimes some very difficult and chronic conditions.
So in short, doctor is saying that now DVT is good, and the lifetime complications, those can be very debilitating. As you said, you can have the chronic venous insufficiency leading to the ulcers, and these patients go on to have a difficult life and to have very, very painful lower limbs and stuff.
Any surgical procedures that can be used in any way? Can surgery really be a part of the treatment for these clot issues?
Well, you're going to
go ahead.
No, well, the surgery we spoke about, we spoke about the vena cava filter, which is surgery. We spoke about the thrombolytics, and one can also try to do an embolectomy also, where you can try to remove the clot itself with a catheter.
Using a catheter in the blood vessels, and you remove the clot. Okay.
But I would suspect that is much more technical. I don't know if we do that here.
No, we do not offer that.
No, that would have to be done by a vascular surgeon or an invasive radiologist. And so that's not something that we would do here.
All right. Well, you know, we have, I think, dissected this subject, you know, pretty much, you know, to the liking of myself, the moderator. I think we would have explained clearly, you know, what clots are, what is happening that can contribute towards the formation of the clots, what you can do to prevent the clots. People who are traveling, they got their advice in relation to the movement. People who are sitting for long hours, they got their advice in relation to not having your feet in one position for an extended period of time without moving, mainly because the veins that return the blood to the heart do not have the muscles of their own to carry that blood back to the heart. So you have to move those calf muscles to send that blood up. And of course, if you do happen to get caught with a thrombus, with a clot, then the treatment modalities and the various tests, the various examinations, many of which are available right here in SKB. We can do the venous ultrasounds, right?
Yes,
Yes.
We can do the D-dimers, right?
Yes.
We can do the X-rays, we can do MRIs and CT scans if the need arises. And for sure, when it comes to the blood thinners, we have available heparin, right?
Yes.
Yes.
We have available warfarin, which is one of the older medications used to treat the clots in our system. And then the new medications, which I'm sure the caller number one, who called and asked about the pharmacological treatments and the non-pharmacological treatments. More than likely that caller would be exposed to some of those fancy names,
Yes,
the
yeah.
Eliquis and
The Clexane.
Lovanex and Savisa and a wide variety. But believe it or not, they all do a good job. And depending on availability and depending on your insurance and depending on funds available, plus the conversation you have with your treating physician, that will determine which way you go. And hopefully you would make the correct choice that is compatible with your lifestyle and your economics and so on and so forth.
And I can't emphasize enough the prevention, because oftentimes, and if a patient would have developed DVT and they're on treatment for 3 to 6 months, if you're going to prevent it and be off of those medication, you're going to have to go back to the basics, back to the prevention of these DVTs, getting your exercise in, changing your diet, losing some weight, you understand, doing the adequate things to prevent yourself from developing a second DVT or a third DVT, or so that you do not have these, to be on these drugs for a lifetime.
Let's take a short break
Yes.
for what would probably
The
be
call,
our
we have a
last
call.
call.
There's a
Our
caller.
last caller, you're on.
Yes, okay. I would like to ask the doctors another question about warfarin, the advantage or disadvantage of using warfarin. I understand the advantage of using warfarin is that if you're bleeding, there's an antidote for warfarin, whereas with Esquis and Paradox and the other fancy ones, there isn't an antidote. You can bleed to death with those. And secondly, is there any disadvantage, any side effects from using warfarin for a long time, many years? Thank you very much.
Yeah, that's a very good question. And what must be made clear, warfarin is a very old drug. And we know that warfarin opposes vitamin K. They work in opposite directions. So that is easily available, the vitamin K. The unfortunate problem with using warfarin for an extended period of time, which people complain about, is the constant digs for the tests that need to be done to stabilize the dose of warfarin. Obviously, you have to have dietary advice. You have to be in close collaboration with your dietitian, who would then advise about the foods which are rich in vitamin K. Vitamin K levels can impact and determine the efficacy of the warfarin which is being used, and of course the test result, the so-called INR, that is used to monitor the dosage of your warfarin. Your doctor probably would be telling you about the use of greens and vegetables, which are purportedly high in vitamin K, and that can have an impact itself on the operations of your warfarin. The Eliquis, the new medications, do not work along that same pathway, so therefore you have to do no tests to monitor their levels. But obviously, if you happen to have problems, whether it be economic problems and can't afford it, or you happen to have other conditions which would allow you not to use those new blood thinners, then Dr. Wilkinson spoke about the filters, and he spoke about other things that can be done. It is important to note, however, that we still use warfarin and we still get pretty decent results with the use of it. I haven't heard of any major problems. I haven't heard.
And it's important to say, because once there's a new drug on the market, like a new kid on the block, we forget the old. And as we said, because of costs, and we are a developing nation, we're going to have patients that are unable to afford the other drugs, that there are newer drugs that are more expensive. So we want to add to your complications with the warfarin, because these persons, if the dosage isn't right or correct, these persons can have blood in their stool, they can have black stools, they can start to vomit, they can have abdominal pain, they can have darkening of their urine and different things like that. So it is important to know that. Hence, once, as you said earlier, once you have you're on warfarin, you have to be closely monitored by your physician and make a lot of lifestyle changes.
Yeah, and it's important also for persons, if they're on these drugs, if they're going to the dentist, for example, for an extraction, it's important for the dentist to know, because they might have to come off these drugs temporarily so that they don't have any bleeding problems while they're doing that. There's just one last thing I want to say, though, because somebody texted me and said, how come we haven't spoken about clots in the arteries? And we were specifically speaking about deep vein thrombosis. One can also develop clots or emboli in the arteries, in the arteries that go to the extremity, and that's why a person will end up losing a limb. But that's not what we were speaking about tonight. That's a completely different topic in terms of peripheral arterial disease and emboli to the lower extremity, which we can speak about at some other time.
Yeah, and it's important to note that blood thinners thin blood. You know, it makes sense. Blood thinners thin blood. And if the blood gets too thin, you can have the complication, obviously, of bleeding, which we're hoping that we don't get to that stage. That is why it's so important to monitor the patients. And if you going back to the warfarin, there's a test called INR that is always ordered. And you try to try to get the dose of warfarin such that your INR remains between a range of 2 to 3. Now, by having foods containing vitamin K in different quantities on different days, that can definitely upset the balance when it comes to the dosing of your warfarin. And I think that is what the caller was trying to allude to with her question. When you're using the newer blood thinners, Eliquis and so on, we do not face that problem. But of course, it's a blood thinner, and blood thinners thin blood. And if by chance you happen to overdose, then you can suffer the consequences. And as Dr. Wilkinson said, if you're going to have other procedures done, in between time you're going to have a dental extraction, you're going to have any procedure in which blood will be produced, then the likelihood of one of those complications of bleeding can come to the fore. So it is important to be in close contact and conversation with the physician who's treating you, so that you can know how to
proceed.
Exactly.
Yeah, one of the benefits of using the more modern drugs, if you stop it, then within 24 hours or so,
you can have the procedure.
You can revert to normal. Whereas warfarin, the effects will take longer. That's why we'd have to give the vitamin K to reverse the effects. Another point I want to make too is that persons who are on blood thinners, especially elderly persons, they have to be careful with head injuries, because you can have a minor head injury and develop a subdural hematoma. You can have bleeding on the brain. I've seen persons even from giving a very hard sneeze where they rock their head so hard, you can tear one of the veins in the skull, and you can develop a subdural hematoma. So when you are on blood thinners, you have to be careful with those things. And even younger persons, if you're on these blood thinners, you should not be playing contact sports, because you can develop hematomas and internal bleedings.
And of course that blood won't be visible. You won't even know until you pass out.
Yes.
Yeah, well, we're drawing to the end of our program. So what I'm going to do, after giving a brief summary, I'm going to pass the ball around so everybody can get their last feel of the ball, their last kick of the ball, their last bat of the ball before we close the show down tonight. It was good for us to discuss clots. I think people now have a greater awareness as to what clots really are, and as to the situations and circumstances under which they can be formed, the tests that can be done, and the availability in send kits. And so it's now for the general public to be wiser in relation to clots and to be more suspicious when you have some of those symptoms, especially the deep vein thrombosis condition of the legs. You can now know when you see some of those symptoms, then you proceed and ask the question, because Dr. Wilkinson clearly stated in the beginning that lots go undiagnosed or undertreated, and the complications can be definitely very dangerous. So, Dr. Wilkinson, for you, if you can give us your last.
Well, just one thing I want you to remember is confinement to bed can give you predispose you to develop a clot. And so after surgery, if you are lying in bed, not moving around, you can develop a clot that can go to your lung and kill you. And so despite the fact that you may have a successful surgery, you can develop a clot just from not moving around. And so you have to understand that no matter what surgery you're undergoing, it's important for you to start getting up and mobilizing very early. Even if you can't get up and move, you can wiggle your toes, move your legs, etc. So you get that blood flowing in the extremities and get the blood flowing back to the heart so that you don't develop a clot, and that can save your life.
And Dr. Osborne?
I listened to the two gentlemen on my left and right. I'm starting to think that you guys must be the grim keeper, bearer of bad news, but I want to end on a positive note. I know that this information can sometimes be scary to many of our listeners, but with the prevention that we've mentioned and we've listed out, you know that you can do a lot to help yourself. By if you're a smoker, stop smoking and start exercising, change your diet, lose some of the weight, get your body mass index down to an appropriate level. And those are things that you can do. Keep active, keep moving around, and take some of the tips into consideration once you travel and you're sitting and doing work at your desk. So it is all possible to prevent this disease. And if you do develop this disease, there's lots of treatment available. And we here in the medical profession, we are always at the disposition to help and to support the members of our community. So thank you.
And of course, Dr. Osborne, if you're going to Rams, don't try to park in front of Rams. You can park across the road and take a little walk, because the exercise is so important. We find that happening regularly here in St. Kitts. People are fighting to get a parking right outside of the building where they're going, and not availing themselves of the opportunity to get some exercise. Critically important in the prevention of some of these conditions. So our closing advice here is that exercise will do a lot in the prevention of this condition, as well as in the prevention and the control of many other conditions. The diabetes issues, hypertension, and so on. It comes back all the time to certain basic modifiable factors. Exercise a bit more, stop smoking. You really don't have to smoke. I don't see any chimneys attached to your head to let that smoke go out. So therefore it means the smoke shouldn't be going in. And that is clear to be said tonight. So with that, I would like to say thank you for tuning into our program tonight. HealthWise, we do appreciate you tuning in to our program and participating in whatever way you can. We always will welcome your questions, your suggestions, your recommendations, and if at any time you have any topics that you would like us to discuss, you can make contact with us. We would willingly bring the people volunteering their time to discuss the particular topic, and we would definitely have fun while doing it. So thank you very much, and have a pleasant evening. And a gentle reminder, I'm going to give Dr. Wilkinson 10 seconds for a reminder in relation to COVID and the very important points that need to be underscored in relation to the distancing and so on and so forth, because what I'm seeing sometimes gets me a little nervous.
Yeah, well, I thank you very much, because I believe that persons are getting complacent. That it's important for us to remember the non-pharmaceutical measures that have worked to contain the COVID-19 virus, which is social distancing, making sure you stay at least 3 to 6 feet away from someone, wearing your mask. And I see Dr. O'Loughlin had his under his chin. It needs to be over your nose and your mouth. Okay. and the
You set yourself.
hand washing, the sanitizing, because you can touch a contaminated surface, but if you decontaminate your hand, then you will not transmit that virus to your mouth or to your eyes and get the disease. And we have done a very successful job so far in controlling the spread of COVID-19 here. We need to learn to live with COVID-19, because as we move towards opening up our borders, the virus is going to come back in, but we need to learn to contain it. And so I thank you for giving me the opportunity to speak about that.
So thank you very much, and we will be back with another HealthWise in another week's time. Good evening.